Hi Claire, thanks for meeting me today. It's great to see you again. Today in our supervision session, I'd really like to discuss with you my client Sophie and get some feedback on the session that I have planned for her. This is the first time that I'm applying therapy to a minor and using the technique that I'm going to be using. So I really look forward to your feedback of the session that I have planned. So as I mentioned, my client is Sophie. She presents with anxiety and tends to avoid academic tasks at school, which is why she was referred to me. A key factor appears to be her self-critical thinking, such as telling herself I'm stupid, which contributes to her disengaging in school, and she feels she's falling behind in her academics. Sophie also presents with ADHD-related attention difficulties and reduced processing speed, which seem to make tasks feel more overwhelming for her, and it's harder for her to stay engaged with at school. The long-term goal that I have identified is to reduce Sophie's academic avoidance of tasks and increase her engagement in school-related activities. A further goal is to support her ability to respond more effectively to her self-critical thoughts so that they have less impact on her behaviour. The short-term goals that I have are to help her focus on being able to step back from her self-critical thoughts, and therefore they will have a reduced impact on her behaviour. I also aim to help her feel more settled and able to focus during tasks at school. I'm going to really prioritise her self-critical thinking, as this appears to be one key factor maintaining her avoidance. For this reason, I have chosen acceptance and commitment therapy, as it focuses on increasing psychological flexibility, particularly by targeting Sophie's cognitive fusion and experimental avoidance. I feel like this is relevant for Sophie, as her critical thinking appears to guide her behaviour, particularly around avoiding her schoolwork. ACT aims to change Sophie's relationship with her thoughts rather than eliminate them, so she can engage in tasks even when those thoughts are present. These strategies also incorporate ACT-based mindfulness techniques to support being in the present moment and having that present moment awareness. And I also want to bring out in ACT that there's that reduced impact of distressing thoughts. I feel it's important for Sophie to look at her values, and I'll introduce those to support as a way of getting Sophie to think about her academic engagement and linking the intervention to what is meaningful to her, as they will be centred in her values. Sophie's attentional difficulties and reduced processing speed further support the use for brief, structured and experiential strategies that I plan to use. Although research has suggested that ACT processes may be less clearly established in adolescence, I feel that its focus on changing the function of thoughts is particularly relevant for Sophie, given her strong identification with her self-critical beliefs. Factors that I've taken into consideration of Sophie are because she has this self-critical thinking, which appears to maintain her avoidance. When she becomes caught up in thoughts like I'm stupid, her behaviour becomes guided by those thoughts rather than the task. So she may be a little reluctant to participate in the sessions. I will again be guided by her. And a second thing is because of her attentional difficulties, which may make it harder for her to stay engaged during the session when learning new skills. So I'm going to really consider this, and obviously Sophie's a minor, and ethical considerations by me is a factor that I have taken into consideration. I also really want to focus on simplifying the language for Sophie, and also making the sessions really accessible to her by doing this. I want to create a collaborative approach and vary tasks for her. One way for me to consider is that Sophie may need times to pause, and I might use the pause points during the session to help her notice what's happening in the moment and support Sophie's attention. Self-reflection is also another consideration for me to be mindful of when working with Sophie, because I don't want to over-explain concepts or confuse her even more. So I want to keep interventions practical and really float-focused, as well as remaining flexible in my pace during the session and be guided by her engagement and readiness. The plan that I have in place, it will, as I mentioned, will be flexible and have engaging activities. So I will build rapport by checking in, using open-ended questions with Sophie, really starting to explore what matters to her, how does she feel about school, and once we've got those values and a couple of values, and I get a sense of what Sophie's really gaining from school, what she finds important about school, what matters to her about school, I will then introduce some grounding exercises, such as I really noticed a pro forma with what we can see, what we can hear, what we can think, what we can feel, and bring in the present moment strategy from ACT to help her feel more settled and able to focus and support her engagement during the session. I will really then move to diffusion by helping Sophie identify her thoughts that are hooking her, such as I'm stupid. And I really want to, again, apply ACT principles by guiding her to rephrase things like, I'm having the thought that I am stupid, which is I'm really wanting to use this to help her step back from her thoughts, and then in the long term help her reduce the impact that this has on her behaviour. If she's going well, I may also introduce metaphors such as imagining the thoughts passing like leaves on a stream as a diffusion technique to help her observe thoughts without getting caught up in them. I really found in my reading and my research the struggle switch metaphor that I identified as being able to help Sophie understand that trying to push thoughts and feelings away can increase distress and maintain avoidance, which will be linked to her experience of avoiding schoolwork. So if I can help her identify this struggle switch of and not pushing against it, this might be a technique that will help her. I will then summarize the session and ask Sophie about how these strategies could be useful for her outside of the session, and give her a homework task of practicing the 5 senses, being present in the moment. What can I see? What can I feel? Having her do that when she's getting anxious thoughts may help her to be present in the moment, and then help her identify that they're just thoughts, or not just thoughts, but she's having a thought, and our thoughts don't necessarily have to have an effect on our behaviour. So really, I really want to help her with the first session to help Sophie have with the overall aim of being able to have her step back from her thoughts, feel more settled, and stay engaged in tasks, supporting her ability to participate in school despite her difficult feelings. That's what it looks like so far, and as I mentioned, I really look forward to your feedback. Thank you so much, Claire.